Hello and welcome to CIO News. I am Khushbu Soni, your host for the broadcast and chief editor at CIO News. This is our exclusive interview series powered by Goto specifically for the healthcare industry. It is a recorded session and will be available on our website, that is cionews.co.in, and our CIO News LinkedIn handle. It is my pleasure to invite our guest for today. We have Amit Verma, the Chief Information Officer from AIIMS Jammu. Amit has 16 plus years of experience working with leading brands like Publicis, Accenture, Wipro Infotech, and many more. And now currently he's associated with AIIMS Jammu. In AIIMS Jammu, Amit has been aligned to implement national digital health ecosystem that supports universal health coverage in an efficient, accessible, inclusive, affordable, timely, and safe manner. It provides wide range of data, information, and infrastructure services, and duly leveraging the open, interoperable, standard-based digital systems. Amit, it is a pleasure to have you today, and we're really looking forward to having a exciting discussion with you.
Thanks, Khushbu, for having me here. So, thanks a lot.
Fantastic. I'm also accompanied by Natasha Rock, the product marketing lead for APAC from Goto. Natasha incorporates 14 plus years of experience in IT sales, customer service, and technical experience to bridge the gap between a customer problem and a product offering. She's a product specialist for the RSG suite, and she plays the voice of the customer internally at Goto. Natasha, pleasure to have you, and looking forward to having this conversation with you.
Thanks so much, Khushbu. Really happy and excited to be here and to be able to speak to Amit as well. Yeah.
Thanks, Natasha.
Fantastic. So to begin with, I have my first question for both of you. We'll start with Amit and then Natasha, you can take it up. What does the typical role look like working in the post-COVID era?
Okay, so there have been a learning post-COVID as well, right? If I talk about healthcare industry, right? So we knew that everything cannot be done via internet, right? So that myth was broken when we were made to use the telemedicine. So that was the first of the key that pushed us towards digitalization, right? And the importance of healthcare as well from the governments, several governments in the world. So healthcare become number one priority, right? And if we see in the budgets and all, right, so healthcare is given topmost priority in terms of what is the budget allocation, what digitalization we need to do in healthcare sectors, identifying the areas where we are lagging, how we can reduce the burden on the hospitals, how we can make the better utilization of resources. Or the government is also very serious in terms of how healthcare can be reached to everyone everywhere, right, without any any grudges or any long queues, which we have seen the patients we have seen the patients going through long queue things, and how those queues can be better managed. Then NDHM or Ayushman Bharat digital mission, that is one of the steps towards that. And if I talk about that, it will reduce the burden on hospitals, and it will have the better utilization of resources. If I talk about a case, I'm a person sitting in Jammu and I have a health issue while traveling to Kanyakumari, right? I don't need to carry, all set of documents with me, all the references and everything. So what I need to have is just my Abha ID, right? And that will go to it will be seen by the doctor whom I'm visiting to. And the important thing is consent management. Without my consent, no one can open those documents and have the history of all those records. So it is a good step in itself. It's a simple example wherein there is one ID, everything is stored digitally, you don't need to carry anything, right? And doctor also knows the history of the patient very effectively. And um, I mean, we will be skipping those areas where doctor is not sure what has happened in the past, and tests have been asked again and again, right? So in a way, we are reducing that workload or the burden on hospitals or labs and everywhere. So it is mainly, I mean, it is based on the concept of interoperability, where hospitals, private hospitals, nursing homes, then pharmacies, labs, they will be speaking to each other with patient as the center, and they will be exchanging the data, but yes, as per the consent management and what are the guidelines around data privacy and security.
Fantastic. Natasha, your thoughts?
Yeah, I think Goto's been in the business of remote working, remote support for the last 20 years now. So we've actually pioneered remote working like 20 years ago when that whole concept itself was so unfamiliar, right? It wasn't even known, a common term, but we have been providing remote working solutions since then. But during the pandemic, it kind of taught us our strongest lessons, I feel. Our usage on our products, we had 17 different products for remote working, right? From collaboration, which is the tool that we're on today, GoToMeeting, for webinars, for trainings, and then IT solution, which is remote supporting of devices in a healthcare setup across industries. So 17 different products for remote working, right? But during the pandemic, our so you can imagine the usage, right? During the pandemic, the usage grew 1,000% across these different products, right? And we saw the impact that it had, right? The sudden shift to remote working for our small scale industries, for our SMBs, right? They were impacted the most, and they struggled to ramp up and to get the right solutions in place. And so what we were doing is providing our solutions for free, right? Because a lot of them did not have the budgets, they had not budgeted it for the year, they were not prepared for it, right? So we were giving it to them for free. And then post pandemic, as things started to settle down over the last 2 years, a lot of these SMBs became more stable, and with that stability, what we decided to offer was stability in our solutions as well. So what we did is we unified those 17 different products that I spoke about into just two key offerings. One is just collaboration for companies that need to be connected to their employees, connected to their customers, to their end users. So connecting the world through our collaboration tools, and then supporting the employees and supporting customers through our IT solutions, which is remote support software, remote monitoring and management software. So I think while we've been in the business for 20 years, I think the pandemic taught us the most, and kind of gave us the hardest lessons, and pushed us forward as well in some ways. And hopefully we are helping companies as well move forward into the next gen.
Fantastic. Great, Natasha. Amit, my next question is, given the demands of today's distributed workforce, it's become imperative to scale up and arm IT teams with right tools. What have been the demands of your IT ecosystem on this front?
Okay, so since things have been set that it should be a digital AIMS, which means technology should form a strong backbone to it, right? So it is more of amalgamation of healthcare with the IT, with IT acting as an enablement for a number of things. It involves process optimization, reducing turnaround times. So how the things are moving, the patient cannot nowadays wait much to get the access to the reports. How those can be reduced. So these are small things that needs to be taken care of. And while before starting the work in AIIMS Jammu, so I was a part where we did analysis, we did feasibility study around different hospitals. We understood the good areas, and yes, some of the gaps we found, wherein the important thing is single sign-on. I have observed that in a big organization or institute, so we end up having 20, 30 products, but the end users, they end up creating username password differently, and it's very tedious task. So it is getting the settings, the basics set from the day one. So that is very important. Second thing is having identity and access management. I have seen in hospitals where a person, or for example a nurse, she is having access to all the systems, all the systems, all the modules of a system. Maybe she's not required to do that. Identity and access management is also a key. So if I talk, having the institute IDs, restricting to only one ID, which is your email ID, and then all, it will form a base for collaboration and communication tools, and the security as well, in terms of having identity and access management and single sign-on. It will itself reduces the time and creates a good experience to the end user. This is from setting the basics. Then having a system is in place which will follow the Ayushman Bharat digital mission guidelines, right? So it is not going in a big bang, but the plan should be set from the beginning so that we can scale it up slowly and gradually. So the base system or the architecture we are making, so that should provide a mechanism we can leverage that for the scale up of things. It is not that we just do the work for 2 3 years down the line, and then there is a problem how we can scale it up, whether it in the form of resources or the sizing we have done for the servers, all those things. So it is better to do the planning in terms of having the system in place for 10 to 15 years so that we can scale it up in a better way, and getting rid of number of systems, instead having a ecosystem where system talk to each other, where each department should not be a function of its own, right? So there should be avoiding duplication of data, right? So these are key things we are planning to take care of. Then small things as well. The important point here, as well as having HMIS system, having all the modules within a hospital. Then having ERPs, which is very important, having an HRMS system which should map end-to-end journey of an employee, whether it is a doctor, clinician, or an admin, right from getting the demand, then to going to interview process, then the shortlisting, getting the offers, getting the inductions done, and during when the person is onboarded, how get that person acquainted with the processes within an organization or institute like AIIMS. Then having the grievance management system, having the right supervisor or career counselors who can guide them. Then grievance processes in place. Or I have seen in certain scenarios where internal job posting matters a lot, where though I'm doing one thing but I'm inclined to do something else as a part of long term goals. So how a career counselor can help me moving to that area, and internal job postings help me out. Then having a system where the moderations take place in best of the ways, where there is transparency. And then all these things I'm talking about, end-to-end journey with the digital reduction of paperwork, right? But yes, there is a hurdle around having how government offices work, movement of files, right? And there is a standard delay of 2 days or 1 day or something. So what we have decided is we'll be having a digital based file movement system, no hard copies, whatever is there. So I just put a letter, and it can, as a part of workflows, it propagates to the higher level, and again it comes back. So it will reduce the paper, and it will reduce the manpower as well. The work will be easy. So it is more of not going mainly into the cost, but putting the money in place so that you can get better outcomes in terms of experience of a patient or a person working within AIIMS Jammu or an institute. So these are the key things which we are planning. It is more of setting the base and going with the minimal viable product, and then scaling up gradually, not going in a big bang way.
Right, absolutely. I think given the demands of moving to digital and also consolidating systems, there is increased pressure on the healthcare industry to ensure the sensitive personal and health information is protected and access to the health data is restricted to the authorized person. So, wanted to understand, are you confident your current remote support software keeps data secure, and are these technologies HIPAA, GSPR, PII, or PHI compliant, or is this also in your agenda?
Right, right. So this is the key, right? Whenever we have to make out a something, or when we have to do an implementation, all the standards and guidelines, they must be adhered to. I'll take a simple case. If there's a process which is from certain product, and we change that process, right, to certain extent, we customize without any standards or anything. And if that product company just modifies that process, and if we get a patch, so our modifications will be overridden. We don't need to want that, right? So all the standard practices should be in place, right? And the other guidelines which should be there in terms of HIPAA standard, HL7, SNOMAD, right? Then FHIR, which is very important for interoperability or setting up metadata and standards, and having the ICT codes in place, so that when the interaction happens, so with the code one can understand what the problem is. So it will form a very uh, common common platform, or a very generic thing which the other person can understand very easily. It is more of following those standards, and the other party can understand it very easily, and the data transfer can happen seamlessly without any hurdles. Or even if there is a change in the future, that can be taken care of you know quite easily. So these standards are very, very important in terms of having a product in place, because these are the guidelines, these are the best practices, and I mean, most of the people do it throughout the world. So while having the product, this is a must. So all the standards should be there, and that the product should be compliant to these standards.
Absolutely. Natasha, same question for you as well. I mean, security being one of the top priorities across organizations. What are the standards by which an IT support tool should adhere?
Yeah. I think you kind of, hit the nail on the head with talking about the compliances, right? And I loved the point about, Amit are talking about, single sign-on, having that customization capability, right? To make the settings as per what the regulations call for, right? Because while every industry in the world today, one of the top IT priorities for 2023 and going further is cybersecurity, is IT security. I think healthcare is non-negotiable, right? It's been there from day one. It's not something that's new. It's not a 2023 trend, right? Because it's a highly sensitive industry, right? Compliance is always a top concern. Like you said, HIPAA, we've got GSPR, PII, PHI, all of that which you mentioned. So, speaking from our experience on in IT support and remote support, I think protecting the remote support sessions that deal with sensitive data, because there's an IT agent and there is an end user, and that end user could be a nurse, it could be a doctor, it could be a practitioner in the healthcare space that's that has access to sensitive customer data, right? Patient records, which is highly sensitive. So I think determining how the IT agents can access that remote support technology is the key priority that the healthcare company needs to focus on with regard to remote support software, right? Because flexible work has its benefits. We've spoken about it, but it also has its cons, in the sense that it blocks that visibility, that day-to-day visibility to what's happening on systems, what vulnerabilities are available, are present. An IT agent has to remotely connect to an end user, to a healthcare practitioner, versus an healthcare, them getting physical on-site support, right? So IT administrators of these IT support, remote support software need to have that level of control, right, where it is completely in their hands to control how much and what access they provide to their IT agents, being able to provide them only the controls that they need to get their job done and nothing more than that. So it has to be a very tightly controlled ecosystem, because what an IT agent can or cannot do in a remote support session pretty much, I think, can make or break the compliance, right? So speaking from experience from providing, a remote support solution, which is very famous in the healthcare industry, which is called Rescue. from Goto. It's been in the market for almost 20 years now. Um, we with Rescue, the way that we've built the product functionality, it is exactly to do just that, right? Which is to provide IT administrators with that control on a very granular level, as well as keeping it end user permission driven, right? So, unless a doctor or a healthcare practitioner provides permission saying, yes, I agree, I approve you accessing my machine, I approve you viewing my screen, taking control of my computer, transferring a file from one system to the other, unless it is approved on every level of the support session, it is not the IT agent will not be able to do any, perform any functions. And we also have, account level sets. Go ahead, Amit. Sorry, did you have something to say?
Yeah, I just agree with what you are saying, right? So, remote systems, so its value in India, right? It has been increased post-COVID only, right? So it is more of having the continuous health checkup of the systems, having events and alerts mechanism that what is happening.
Absolutely.
So what is plan B if things happen? If there is a phishing mail itself, how we can stop that remotely, or having active directory, how we can push the rules policy, how we can make the updates. So everything is seen in a broader perspective spectrum now, because earlier it used to be just a software will do that, so who will hack our data or whatever it is. Now with the awareness and everything, people are understanding what this is, why it is very very important, how we can safeguard our facility. I mean, in terms of business continuity planning, what
Exactly.
measures to be followed, right? And that is completely done when there is a BCP need. It is via remote system itself, right? That is the
Hmm.
savior that becomes the lifeline for people and patients to remain in connect. Yeah.
Absolutely. I couldn't have kind of very neatly summarized what I was trying to say. So thanks for that, Amit.
Yeah.
Great, fantastic. So Amit, most of the time an organization's productivity suffers, because of lack of a technical assistance while operating from a distant location, right? So, how have you been managing the same, and how the technology has been helping hand in managing such remote work scenarios?
Okay, one of the key issues which is felt most of the times is the speed of the performance. The systems go slow, and we do not understand for example, I'm sitting here, so I should have my internet fixed, right? So that is the key thing. I should have the best connection so that I can leverage the best experience of remote system. There should not be any interruptions or anything. So that is one side of it. Other side of it is the remote system itself, the performance, it should be up to the mark, it should be up to the standards. So there should not be any data breach or anything. It should have been tried and tested with proper penetration testing, security testing, all those aspects should be there. And sometimes what happens is people are not very well versed with the remote ways of working. I remember, when this pandemic happened. So I have seen all of the people in education institutes, they were not aware how to use a laptop. And Microsoft was giving MS Teams for free to the school and institutes. And that is the way all the ladies they get it learned from their kids. Or there were small small sessions, and they moved. There was a journey from checking the things on the notebook to on MS Teams, how that can be made. Um, it is because of the keenness to learn and what the current situation is. So where there is a will, there is a go. So there are alternatives. Anyways, it is more of how you are inclined to get acquainted to that change. That is very important. And as an organization, it again comes as a part of change management, where there should be regular trainings, via the trainer approach, identifying the key champions who can bring that value or pass that value or the instructions to their team, their respective teams itself. So in a collaboration, all the stakeholders play their role, whether it's an end user, as an organization, or as a team head. So everyone has that part to play in terms of this ecosystem of remote working.
Great. I think covered most of the aspects. But Natasha, if you would like to add, since you also interact with a lot of other healthcare institutes, so any top priorities that they've also been considering for remote support solutions?
Yeah, absolutely. I mean, we do have a fair bit of healthcare customers, and like I was speaking, right, being the rescue being compliant on all those different fronts, giving that control and giving that customization, controls to the IT administrators has been one of some of the top priorities when they use rescue, right? But when it comes to what a healthcare company should overall look for when they're considering remote support technology, whether it's ours or somebody else's, I think security is number one, of course, for all the reasons that we've already covered today, right? I think it goes without saying. But second would also be supporting a broad range of devices, right? Because no longer are we limited to just our desktops or our PCs in the office or in the hospitals, right? It is a huge breadth and depth of devices, different operating systems, different types of devices, mobile devices, handheld devices, laptops, desktops, and then supporting a broad range of devices as well as supporting them on any network, right? Not just limited to one particular network, which is restricted to an office or to a healthcare setup, but also mobility and offering that control across the locations that the users are in. As well as conversely, I'd say if a healthcare company wants to restrict it to a specific location, saying within the hospital, within the diagnostic center, then they should have that flexibility to do that, because some companies do, some of our customers even choose to do that. So limiting the accessibility to a particular IP range or a domain, right? And also being able to customize it for security purposes as well as for practicality, right? Because some of the healthcare customers that we've been working with, some of their requirements when they came on board with us was supporting the doctors, the nurses workstations when they are present at their workstations, as well as when they are not, right? Because they are always busy, you don't expect them to be chained to their desk, right? So they're always running around, they're always busy, but if their machines need support, that remote support software should be able to work on that machine, whether the end user is present or not, attended or unattended, right? Also being able to support scalability, right? Like Amit so really rightfully said, the uptime, it needs to be really reliable in terms of being available whenever they need it, right? Like for example, in rescue, it has been 99.99% since the last 20 years that it's been in the market. But we know of solutions that have had a lot of issues, right? They suddenly go down, they have downtime, they have maintenance activities, which is when you need that tool the most, right? And that's totally not acceptable in a healthcare setup, because these machines that are used in a healthcare setup are machines that are connected to physical devices, right? You have your devices which are connected to, say, dialysis machines. You have them connected to monitoring machines, right? Blood pressure monitoring devices. You have physical devices like medical equipment which are connected to these devices. So these devices need to remain running and up to support the hardware and support the physical devices, right? So downtime cannot uh, be accepted on any level, right? As well as being able to onboard. I think Amit also spoke to this to some extent, which is onboarding new staff, right? Onto new tools, which is your electronic medical record software or other software which is used within that setup. Being able to onboard the users as well as get them up to speed for rotational staff that come in different shifts. Being able to get them, using those tools and using those devices on a daily basis, giving them that support, because we always don't have trainers, we don't have IT staff which is present physically, so giving them that remote support on those devices when they need it, right? I'd like to just quickly leave with a quick example of a company that came on board with us, and they're using our remote support technology in a very fascinating way, right? Especially in the healthcare setup. It's a company called Hologic. I don't know if you're familiar with this company, Amit, but it is a US based healthcare and medical diagnostic company. And they realized that they desperately needed change when their IT support staff were dealing with about upwards of 4,000 tickets a month. right? And half of these were on the phone call. So imagine 2,000 calls a month, and these required remote support. They required remote control of those devices, right? Of those medical devices. And these customers of Hologic, they were clinically ready, they were clinically trained on how to, use all of these medical devices, but they were not technically trained or technically capable, right? So they would face technical issues, they would run into issues. How do they troubleshoot? How do they support devices with an operating system which they were not familiar with, right? So what they decided to use was our rescue product, which has a lens capability, which is giving the end users or the customers using the devices the ability to live stream what's happening, right? So live streaming through their mobile video what's happening on those devices to a support desk. And that support agent would be able to see what's physically happening on those devices, get them, give them training, give them, troubleshoot the issues, provide that support. And so ultimately, they came back to us and said, it has been so useful that it's reduced, first of all, a lot of the issues that they were facing because, they were trained, they were onboarded, they were up to speed. So repetitive issues did not occur. Plus, it also did away with the need for sending IT technicians physically to those, healthcare setups. So it saved them a lot of money. In fact, I think this it saved them upwards of, I think, $50,000 on each individual device, right? Because that's how much they were spending and sending an IT agent every time there was, an issue faced. They needed to be onboarded. They needed to be trained. So that's
Right.
a
And
quick,
Natasha, this is hard to,
yeah,
yeah. So, I mean, these are the real-time examples. And what we are doing here is, we are following the concept of lean, green, and digital hospitals. And this is a part of lean operations. I mean, understanding that, 2,000,
exactly.
4,000 tickets getting piled up, right? Then what is the best way out? Because sometimes what happens is there is lots of asymmetry in the data. You cannot understand what to do. It is more of understanding a system, doing the feasibility study, doing the root cause analysis, why the ticket volume is so high, what are the pain areas, where the volume is. I mean, again, applying the Lean Six Sigma principles over there and finding the waste, how we can reduce that. And it
Absolutely.
might call for, some money in the beginning, right? For sunsetting a previous system and making a new system or replacing it with it. There is a cost associated, but in the longer run, there is a good experience to the customer or the end user. Then there is reduced in time. Then the tickets, right? The volume definitely gets increased. So it is finding a problem, fixing it, whether it comes with a cost or not. The end of the day, things should be like more of a happy patient, right? I mean,
Yes.
that
That's
should
the
be the
end goal.
key. It
Yes,
should be around
exactly.
patient centric things, right?
Absolutely. And I think just to add to that point, I think something that I wanted to cover was also the reporting, right? Even the remote support technology, although just a small piece of that ecosystem, the reporting that you can look at, the analyzing that data, right? When were the most amount of tickets that you got? Was it at the start of the day? Was it at the end of the day? How are my agents handling those issues? Do we need,
Right.
multiple layers of support, L1, L2, L3? Do we need them to
Yeah.
be able to collaborate together? Right? All of that data needs to be available as part of that remote support tool as well. Although it is just a piece of that ecosystem, it contributes to the larger, like Amit rightly said, the happy, healthy patient.
Right. Sometimes the data is available, but we do not know how to interpret the data, how to make analysis out of it. So having the data and then interpreting the data where the,
Yes,
bottlenecks are, right? Identifying it, then removing it. That is, how the things move for the betterment.
absolutely.
Yeah.
Great. It's been a great discussion all this while. I think we covered and touched upon on various aspects, right from change management to the adoption to the security piece, right, and the must-haves in the remote support. So, wonderful pointers. Thank you so much, Amit and Natasha, for taking out time and joining us today on this platform and sharing all your valuable insights for our viewers.
Thank you, Khushbu. Thank you,
Thank you.
Natasha.
Thank you for having me. Thanks, Amit. It's been really a
Thank
pleasure.
you.
Very
Same
insightful.
here.
Thank you.
Thank you.